You have now heard from the perspectives and experiences of fathers and providers who strive to advocate for them and their families. In this part of the training, we will rely upon art-based research methods, such as poetic inquiry, spoken word, and hip-hop, to process key themes and generate lively and authentic discussion with fathers and providers on how to address system and structural barriers. Our artists, Farrah Tucker, Divine Karama, and Dwayne Smithers, did a remarkable job of relying upon the data we collected and the quotes from interviews to disseminate all of this information in an artistic format, more accessible to members of the community. To help set the stage of this discussion, I will take a few moments to share what providers said needs to happen to engage fathers. Providers highlighted strategies to mitigate barriers within each of the micro, societal, and systemic contexts. After grouping and regrouping codes during the analysis phase, we came up with a phrase that related to the micro-level context. Help fathers reclaim their rights, with an emphasis on reclaim. The R stands for relational healing and showing kindness. E stands for empower. C represents cultivate authenticity. L stands for listen and be present. A signifies appreciate fathers and tell fathers they are valued and worthy. I is for identify and disrupt paternalistic engagement approaches. And finally, M represents meet fathers where they are at. All of these core ingredients align with strength-based practice. Also within the micro context, most providers highlighted the need to engage in reflexive practice. This quote illustrates perfectly how this provider engaged in reflexive practice during the actual interview. Quoting the provider, I had heard from several of them that I did not understand where they're coming from because I was a white boy from an upper middle class neighborhood that didn't understand their situation. Which is true because all of them were black and all of them had court issues and they were at the halfway house for a limited number of time. End quote. They also discuss what factors motivate fathers. They include community and sense of belonging, building connections, and encouragement were the salient factors. When asked what motivates fathers, this provider underscored, and I'm quoting, basically at the end of the day, with this population, it's not what you say, it's how you make them feel. And they, referring to staff delivering father-focused programming, always made them feel important. It made them feel heard. They made them feel seen. Like I said, you're already talking about a population that's the least of them, and so when you're able to connect and do that for folks, it works. End quote. Reacting to micro and systemic barriers, they also discussed the need to implement father-focused programs and services, namely to embrace a masculine fatherhood approach by discussing what it means to be a man, and not assuming programs for mothers apply to fathers. The providers also underscore the need to let fathers lead and center their voices. They also shared that providers and systems should work towards ensuring fathers have access to diversified supports, including psychological, informational, and tangible supports. Finally, modifying their organizational and macro context would allow providers to feel they indeed have control or the ability to engage in father-focused practices. The organizational climate must be optimized to engage in reflexive practice. And transformational leaders who can model and motivate father engagement strategies are needed to cultivate those spaces. Political advocacy, namely investment in fatherhood programming, and an effective and efficient process for referring fathers to that programming are needed. This quote speaks to the investment piece. The general public has to understand that the positive changes that will be made in this man who's struggling right now, if there needs to be tax dollars invested into it, so be it, but the investment is going to be so worth it in the long run for generations to come, end quote. We've only scratched the surface when it comes to unpacking what is needed to address the structural and systemic barriers related to engaging fathers, barriers that remain pervasive across child and family serving systems for decades. We will begin by asking our panel of 3 fathers to share art-based products and rely on the content to reflect on their own experiences of system involvement, fatherhood, and structural oppression. Then, 3 providers will join the conversation. They will also read poems, reflect, and engage in conversation with fathers. We hope that through these conversations, we will reach some common ground and generate recommendations for how you, either as a provider, advocate, or caretaker, can be part of an important initiative to engage fathers and ensure they play a healthy role in promoting child well-being.